In Good Health, we're looking at a disabling disease that has affected world leaders, but it's also inspired a very famous villain.
And this condition also affects plenty of not-so-famous people as well. Our Dr. Frank McGeorge is here to explain what it is and also a revolutionary new treatment that's changing lives. Doctor?
Now, you've probably never heard the name of this condition, but odds are very good you've seen someone suffering from it. It's called a Dupuytren's contracture, and it causes the fingers to bend into the palm of the hand to the point where patients are unable to do everyday activities like hold a glass, shake hands, or even button a shirt. Now, surgery used to be the only option, but now a new treatment is changing that with dramatic results.
A lot of my friends kept saying it's carpal tunnel, and I really didn't know what it was.
For Bev Tasker of South Lyon, the problem began 4 years ago. Her hand is stuck in this curled position.
I can't stretch my hand to pick up a vase, and I can't put my hand flat, and I'm noticing typing on the computer. I'm having trouble now.
It's called Dupuytren's contracture. The name was derived from an old French surgeon in the 1800s.
Beaumont doctor Paul Shapiro is an orthopedic surgeon at the Michigan Orthopedic Institute in West Bloomfield. He says Dupuytren's affects up to 6% of the world's population, including the late President Ronald Reagan and former British Prime Minister Margaret Thatcher. The author of Peter Pan also suffered from Dupuytren's, and it's thought the condition inspired his famous villain, Captain Hook. Now, Dupuytren's affects the connective tissue under the skin of the palm. Knots of tissue form a thick cord that pulls the fingers into a bent position. Doctors aren't sure what causes it, but it occurs more often after age 50. It seems to run in families, and people of Northern European descent are at the highest risk. Smoking, drinking, and diabetes can all increase that risk. Until recently, surgery was the only option.
The standard treatment has been an operative procedure where we would make incisions across the palm of the hand and into the finger.
But now doctors have a new option, an injectable drug called Xiaflex. Xiaflex is made from a mixture of enzymes, special proteins that essentially eat up the tissue that's curling the fingers. Bev is willing to give it a try.
It's continually getting worse, so I know that if I don't get something done, I will lose the use of my hand. So.
Okay, here's the cold spray.
The procedure only takes a moment as Dr. Shapiro carefully injects Xiaflex into Bev's hand.
We're just going to bandage this up and send you home.
The drug takes 24 hours to work. The next day, Bev is back. Now, Xiaflex isn't effective for everyone, but if it is, Bev's fingers will straighten out with pressure. Now, if you're squeamish, you might want to look away for a moment. Dr. Shapiro numbs Bev's hand and...
Push on that. There it goes. Done.
Oh my gosh.
You see how it just opened up there? Yeah. So there you are.
Bev's bent fingers are now straight for the first time in years.
It didn't hurt. It just was a weird feeling when it popped. You could it was like you could feel your skin pop.
The recovery is really quick. It's 2 to 3 weeks. The patients are almost back to full activity.
Compare that to 2 to 4 months of recovery time for surgery. Bev says this is an easier option.
Much better, much better. Anything that's less invasive, I think, is 100% better.
4 days after the procedure, Bev is back for a checkup, and just look at her hand now.
It's fantastic. It allows us to achieve the same goal faster without the high risks involved with surgery.
Xiaflex has been approved by the FDA, but there are potential risks, including swelling, bruising, tendon damage, and nerve injury.
It needs to be done by a qualified hand surgeon because it's a dangerous substance if not used correctly.
Patients will need to do finger exercises to regain mobility and may need additional treatments in the future. Bev is just excited to have her hand back.
I think it's wonderful. I'm really happy with it.
Some insurance companies are paying for this treatment. Now, obviously, it's significantly less costly than surgery, so hopefully all of them will cover it in the future. You can learn more about Xiaflex at clickondetroit.com/health. Back to you.
It's phenomenal. It was hard to watch there for a second. Needles in the hands don't sound like a good idea. And experts say the ring finger and the pinky finger are the most commonly affected. The middle finger can be affected, but if you've got carpal tunnel on your middle finger, you're probably a New York City cab driver.
It's so great that you don't have to now always have surgery. So
Right,
many people
right.
don't like that
It's a huge
cutting,
step.
yeah.
Yes.
All right, let's take a look at what we're working on rather for tomorrow night. I'm Paula Thomas.